originally. However, I moved to Boston for grad school. I went to Simmons College, and the way that I got started with MS was kind of random. I was a new grad, probably had only been working for maybe 6 months or so, and the company that I was working for wanted to develop an MS program. So, by a show of hands, who wants to do this? And I had no reason of wanting to. I think I was just eager for all of the new opportunities that grad students have, and ready for life and to tackle it. So I was like, yeah, sure, I'll do it. And from there, very quickly, I learned how extensive multiple sclerosis was. I only knew the basics of it. So, the foot drop, the sensation issues, but it was shocking and exciting to me on how diverse multiple sclerosis was. So very quickly after starting to develop that program, I decided that I wanted to get my MSCS, which is my multiple sclerosis certified specialist. So I got that, and then I started doing presentations like this. The reason that I like working with this population, doing presentations, is because my favorite thing as a physical therapist is brainstorming. I don't know why. Some people aren't that way. I'm very much a brainstormer. And if you haven't figured it out yet, every single person who has MS is different. You could be the same age, same gender, diagnosed with the same type of multiple sclerosis, but your symptoms are vastly different. And that, to me, is something that I love brainstorming with each individual person on how can I help you. And to be honest, I think this information that I'm going to be giving is, to me, and it might just be because I'm a physical therapist, but to me, it's very basic, and I'm always so surprised to know that you guys don't know a lot of this. And I feel like by presenting this to you, I can give you guys some hope and some inspiration as to things that you can do to work towards your goals and to get better, and not just to feel like, okay, I have MS and let me just, sit here and talk to my neurologist. There are so many things that you guys can do. So, if you guys have any questions, if you want to just ask while I'm on the slide or at the end, your call. Okay, so this is your typical slide. If you've been to presentations before, you've probably seen this a million times. But exercise in general is so helpful for everyone, not just MS. These are general things that can help with, but it's true for MS too. A lot of people think that since I have MS, I might not be able to get muscular strength from exercise or aerobic capacity or walking. But you definitely can. There are specific parameters, which I'll talk about later on. So you definitely can get better. I'm going to go through each one of these targeted points to tell you how you, as someone or someone you know has MS, can improve with those categories. So the first one is muscular strength. You definitely can improve your strength. Strength is sometimes one of the first things to go, and it's something that even if you have relapsing remitting or even a progressive disease of MS, then if you do things now, it is proven to show that when you have a relapse or if you have a progression, it may not be as intense, and or if it is relapsing remitting, you will recover quicker. So when you do specific exercises, it's not always your general lunges and squats and jumps. They are targeted to what your issues are. Also, when you start working on strengthening, your walking can get better. Oh, I have a clicker or a pointer. There we go. So you can have an improved gait pattern, reduced fatigue. If you are stronger, your muscles have to do so much less work. If you're fatigued and weak, the muscles that are strong are doing way too much work, and you're going to get fatigued just simply because of that. So if you can strengthen these weaker muscles, your fatigue is going to be less, and you'll be able to do more things throughout the day. And with all of those things, just improved independence. If you're stronger and you can walk better and you will have less fatigue and you can breathe better, you'll be more independent as well. Aerobic capacity. I love this research that just came out a couple of years ago because it proved that if you have multiple sclerosis, all you need to do to get aerobic capacity and to get the benefits from aerobic capacity with physiology and psychology is low to moderate intensity. How amazing is that? I have so many people tell me, oh, I don't do aerobic exercise, I can't work that hard. Because everyone feels like aerobic exercise is, jogging in place or getting your heart pumping and you dripping in sweat. It only needs to be low to moderate. So if you don't know what to do, I'm here all day, you can ask me. But there are so many things that you can do that's low intensity for aerobic capacity and getting your heart going that you can benefit from. And I think I mentioned this later on in a slide, but super exciting news that just came out. Nancy, our occupational therapist who's in the back there, we were just at the event in Nashville. It was the annual Multiple Sclerosis Consortium. And one of the newest pieces of research that came out was saying if you do aerobic capacity first, then your exercises, it primes your brain for neuroplasticity. And if you don't know what neuroplasticity is, that's fine. I'll explain it later. But super, super exciting. It's so new that they don't know how much the intensity should be for your aerobic exercise or how long you need to be doing it, which I'll keep you guys posted as soon as I find out. But super exciting. Or at least to me. Okay. By a show of hands, who in some way, shape, or form will want your walking to be better? Okay, keep your hands raised. Of those people who want to walk better, how many of you confidently feel you can balance on a single leg, one leg, stable, not wobbly, for 5 seconds? Wow, every hand went down. Okay, so I love talking about walking because as you can see, a lot of people want to be able to walk better. Walking requires strength, balance, and endurance capacity so that you can do it for a longer period of time. So let's talk about the strength piece of it first. I was talking, I think it was Jane earlier about this, but if you have strength in your hip flexors, I'll use this leg, I don't want to move the mic. This in your hip flexors to bend your hip, in your knee flexors to bend your knee, and in your ankle, they're called dorsiflexors, to lift your toe. If you have those 3 things, you're good. Plus balance, but we'll get to balance later. If you only have strength in 2 of those areas and one doesn't work, those other 2 definitely can help compensate, but they are working so hard. So again, you're going to fatigue quickly because those muscles can't do all of the work. And maybe you have strength in all 3 of them, but they're not really that strong. Your walking is going to be affected. When you walk, the reason you need those 3 movements is because, if I stand over here, you need to be able to bend your knee, swoop your toes up, bend your hip, and then put it all down with your heel first, not your toes. So if you can't do any of those 3 movements, then you're not going to be able to walk very well. And if you are walking, it's going to be so fatiguing for you. The other side of things is balance. So a lot of people don't realize this. However, when you're walking, I'm going to really slow-mo this for you guys. As my right leg is about to come through, look what I'm only standing on one leg. So assuming you are not using a cane or any type of assistive device, you need to be able to balance on one leg. I say 5 seconds, I'm a high achiever. So really it's probably about 3 seconds. Solid, not 3 seconds of this. And then when my left leg comes through, I'm in a little bit of a wedge today, so might fall over. When my left leg comes through, you need to be able to balance on your right leg. And so forth. So walking is really a series of balancing on one leg with a little bit in there balancing on both feet. 40% of a gait cycle is on one leg. So you need to be able to do that. And even if you are using an assistive device, if you're using a cane, a walker, a rollator, crutches, whatever it might be, you don't want, those are not meant to support your full weight. A lot of people think they are. If you're putting all of your weight through that, you're at a high risk for falling. So you still need this balance. Another one of my favorite exercises, balancing in a staggered stance, because when you're not in single leg, you're in a staggered stance balance. So if you can fix, and fix probably isn't the right word, if you can improve single leg balance and staggered balance on both sides, your walking is going to improve so much without even working on strength. But it's always good to work on both. So that's how important strength and balance are to walking and why it would be related to anyone who raised their hand for walking better. Fatigue. I like this slide because a lot of people who either come to me as their physical therapist or at these events will say, well, Gretchen, how am I supposed to exercise? I'm so tired. And let me back up for a second. I don't know if you guys know this or not, it might not be common knowledge, but there are two types of fatigue. There's primary fatigue, which in MS, it means that you are physically exhausted, drained, heavy, can't move for no reason at all. You may have gotten a perfect night's sleep, and you feel that exhausted and heavy and drained. Or you didn't do anything, no exercise, but you just feel that way. And then there's a second type of fatigue where there's a reason for it. You didn't sleep well, you did exercise, you were out at a summer barbecue, it was really hot, so you're fatigued because of those reasons. Those reasons are much easier to manage because you know why you're fatigued. The other type of fatigue, it's harder to manage because there was no reason, nothing that you did that caused that. With that said, when you exercise, it actually can improve the fatigue. But a lot of people come to me and they'll say like, oh, I can't exercise, I'm so tired and I'm so drained. But a lot of the exercises that I personally give as a physical therapist are sitting down or lying down. I have two different types of program that I give a lot of my patients. One is a fatigue day and one's a rock star day. And if you're having a rock star day and you are just going for it, you've got full strength, you're going to go for a walk, I have a program for you. If you are having a day where you're fatigued and drained and you just can't really do much, the last thing you want to do is get out of bed, I've got bed exercises for you. As long as you do something, it can actually help you with your fatigue. Depression. So I think this is a lot of mostly common knowledge too. A lot of people feel or know that exercise can help with depression, stress, all of those bad things because it helps endorphins. And long story short, it's also true with MS. Even though depression in MS is caused from the neurological symptoms that are happening, exercise can still help. And these are just a couple of current research articles that showed that your depressive symptoms will last a shorter amount of time and will not be as intense if you're able to consistently exercise. Quality of life. So of all those things I just mentioned, your walking, fatigue, your strength, your balance, if one of those things was better for you, how much better would your quality of life be? Even if just one of those things. Exercise, though, is proven to help all of them. So imagine if just one of those was better for you, your life would probably be better. I don't want to speak for you here, but I'm assuming it would be better. Imagine if you had 2 or 3 or 4 of these effects from exercise, just a little bit, you still would have such a better quality of life. So exercise, I don't know what your viewpoint on it. Maybe some of you are avid exercisers, you're going 6 times a week, or maybe you don't do anything at all, or you fall in between, but it's at least worth giving a shot. And I'm going to talk to you about what you specifically should be doing when you have MS. Okay, so if you aren't, I hope I've convinced you, but if you are not already convinced, there are MRIs that show that more fit and healthy people who exercise have a reduced deterioration in their part of the brain that had a lesion, which is amazing. And what that goes to, let me try to use my pointer again. What that means is that you can recover quicker. If you have relapsing remitting, you can recover quicker, and it can reduce long-term disability. And somewhere out there it says that it won't be as intense because you're starting off at a stronger point, a more balanced point, a less fatigued point. You're starting off better. So MRIs show this too, it's not just me saying this. Okay, neuroplasticity. Show of hands, who has heard what that word before? Okay, do you guys know what it is? It sounds like, to me, before I knew what it was, it sounds like a scary word. It sounds like a word that goes right over your head. It is so important, I think, to understand what it is because it's why exercise and physical therapy works, specifically in MS. So neuroplasticity is the theory that our brain can create different pathways and different things to happen. So because not all of you can see my legs, I'm going to use my arm as an example. So let's just say, for sake of demonstration, you have a difficult time doing this, like picking up a cup of tea. So let's say you can't do this at all. Like you go to pick it up and your elbow just doesn't bend. So what your brain does, every time you attempt to do it, your brain tries to find a different pathway. So let's just say this is the part of your brain that needs to light up to say, Gretchen, pick up that cup of coffee. And it needs to travel there. So I'm going to go pick up the coffee. It doesn't work. That pathway did not work. So I do it again. And my brain says, okay, do this instead. And it doesn't work. Okay, do this instead. This is awful. I don't know what this is. But there's trillions of different pathways to get from here to make that work. So many pathways. So a lot of people, when they can't do something, just don't do it. Or maybe you work on it for a little bit, but then you still can't do it and you give up. The thing about neuroplasticity that we don't know is how long it takes, which is very unfortunate we don't know that. I'd love to give you an answer, because it could mean it would take you 3 years of practicing that exercise. With that said, for some of my patients, I had a patient yesterday who I've seen him once, evaluated him, and he's having a foot drop, so he scuffs his toe, even though he's wearing an AFO. And so I had him take the brace off, and I had him demonstrate. I had him try to lift it, and he could lift it, but he hadn't done that in years. So I saw him a week later, which was yesterday, and he can do that on his own now. So sometimes all you need to know is that you're not doing it. Just having someone point out to you, like, oh, you can't do that, you should be doing that as an exercise. And it'll come back within a week. Other times, 3, 4, 10 years, we don't really know. So, does that make sense? Because neuroplasticity doesn't happen in all diseases. It's amazing that it happens in MS because it's why you can get better. So, neuroplasticity, the way that you get it to work is by repetition of exactly what you want to happen. So if I'm doing this, if I'm practicing it, and let me back up too. Let's say I can do it, it's just weak, and it just takes forever, and it's just not good quality. The connection from here to here, whatever pathway it's taking, that connection is working, it just needs to be strengthened. So you doing this as an exercise is strengthening the pathway. I was telling someone else earlier today, a lot of the exercises that I give my patients, I explain to them that it's a brain exercise. I'm not trying to get you to lift 100 pounds like this. I want you to lift a coffee cup. It's more of a brain exercise. Get your brain to use that pathway over and over and over and over again. And that's how you get neuroplasticity to work. The downside of that is, if I am going to lift my cup of coffee, by the way, I'm a tea drinker, coffee's way too bitter for me. But if you go and grab your cup, and I'm doing something funky because my brain doesn't know what I want to do, and it's doing that, so I can do it, I can get it to my mouth, but it's doing something weird. If I practice that over and over again, my brain thinks that's right. So you don't want to keep repeating bad habits or bad patterns, because your brain is going to think, oh, this is what she wants me to do, and it's going to strengthen that pathway instead of what you want. And I'll talk a little bit more about that in a second, but perfect quality, high repetition. Okay. So I've tried physical therapy before, and it didn't work. And I won't make you guys raise your hands, but I know for a fact a lot of you in this room, probably a volunteer who raised your hand. I know a lot of you have been to PT before, and it didn't work. And the thing about that is, I 150% believe you. It is, especially if you were not at a physical therapist who was also a multiple sclerosis specialist. Some of the exercises might be the same that an orthopedic physical therapist and me would give, but it's the parameters that you do it with are so different. And I won't get off too much on this tangent, but I once went home to do a presentation similar to this one, and it was someone who I used to be a clinical instructor, or he was my clinical instructor, and we were discussing how to stand up from a chair, and because that's a lot of people have difficulty with that. He described it perfectly for someone who just had weakness and with an orthopedic reason. And the person that he was demonstrating it to had MS, and she couldn't do it. And it's so different approaching it from orthopedic, like, well, why can't you do it? Just strengthen, do squats over and over and over again. Versus, let's break it down, get you a really high C, get that neuroplasticity to start happening from a higher level, and then work your way from there. It's not that they're not strong. You guys might have full strength in your arms, your legs, your core, but if your brain's not working the right way, if it's not sending the messages, it doesn't even matter that you're that strong, because you're not using that strength. So it's a very different approach, orthopedic versus multiple sclerosis specialist, who knows these things that you guys are dealing with. So I believe you that it didn't work. Okay, so newest guidelines. So the first one, do not exercise until the point of fatigue. Hopefully you guys know this. It's not a no pain, no gain, no fatigue, no gain. It's definitely not one of those things. If possible, you want to be able to anticipate when you're going to be fatigued. And I just start to giggle because a lot of people can't do that. Like, you don't know until you're actually tired. The best advice I have for you for that is to start with baby steps. If I were to give you an exercise, I might say do five repetitions, and that's it. And that's it for the day. And then later that night, are you tired? If not, awesome. Tomorrow do 10 sets or 10 repetitions, and then build your way up from there. Don't just go in gung-ho and try to do like 100 repetitions of all the exercises. So stop before you are fatigued. Once you get fatigued, you're going to have bad quality. Number 2 is, what a great segue, perfect quality. So our brains remember what we do more of. So if you're doing this funky thing more than the good way, it doesn't even matter that you did the good way. Your brain thinks this is right, and it thinks the good way is wrong because you're not doing it as much. So, and also, third one is high repetitions. So for my patients, when I give them exercises, I give them guidelines. One, and we'll do exercises in a second, but one exercise might be marching, seated or standing, doesn't matter. On the sheet that I give them, I might say, do this 10 times 3 repetitions, or 10 times 3 sets. But what I really want them to do, and I educate them on this, is view that as, okay, Gretchen wants me to do this 30 times. I do not care if you can do 10 in a row, and then 3 sets of that. What it might look like for you guys might be, your first set is 10 perfect ones. But then the second set, you can only do 6. So you do a third set, that's 3. And a fourth set, that's 2. I haven't been adding those up, so I don't know what number we're at yet. But then a couple of sets of 1 and 1 and 1 with a ton of rest breaks. Every single exercise you do should be that way. So if you're not doing that, you're probably working to the point of fatigue. It's probably not all good quality, so the neuroplasticity doesn't know, it's confused. If you even do half good, half bad, your brain doesn't know. You gotta do more good. Even if some days that means you do 1 set of 5. On your rockstar days, you might do 5 sets of 10. And then dual tasks. Do you guys know much about cognition in MS? Just a couple head shakes. So one really cool thing, and I do this all the time with my patients, so many people have difficulty doing 2 things at once, which, I don't even know if I can do this, but that thing, but my patients, they can't have a conversation with me if I'm also asking them to stand up, because it's two things at once and they can't do it. Or they cannot be walking and I'm over here like, how's your weekend? What you doing? And they can't talk to me because they're focusing on not falling and walking. Or what's another one I hear all the time? Getting in and out of a car, people are trying to help them, do this, do that. They can't focus on those things. The great news, if you guys didn't know, you can train that. So dual tasks simply just means practice doing 2 things at once. So my best example for you, let's go back to this exercise. If you get to a point where you're like, good, at this exercise you're confident, you're at a point where you feel like, why is she still making me do this? Add a cognitive task. My best examples for that would be either, if you're a numbers person, you might actually be good at this, but so do this exercise and count down from 100 by 3s. I'm not a numbers person. I tell my patients all the time, I can't do this. I don't know if you're doing it right. Just out loud, try to actually do that. Focus on those numbers. If you're more of a word person, do this exercise at the same time that you are saying all of the female names that you can think of possible, or everything that would be in your refrigerator at this moment, or things you'd find in the sky, like, it doesn't need to be anything intense, just do two things at once. Or if you're alone, tell yourself, what is your plan for the day? Specific plans, like even what time are you going to get up? Do you roll over first, or you just pop out of bed? Do you then go to the bathroom? Or do you put socks on before you go to the bathroom? Do you put slippers on after you put your socks on? Or maybe you don't do either of those. When you get to the bathroom, do you need to open the door? And so like that specific, just really think about all those things as you're exercising. It uses a different part of your brain, and often that is a part of your brain that might have lesions. So that's what you can do for that, in case you were wondering. Okay, so let's move. So I'm giving you guys 3 of my absolute favorite exercises. So you guys can stay seated. I have all my patients do this sitting anyways. So get a little bit of room. And this first one is marching. You're just going to do what that photo looks like. So feet firmly planted on the ground. If you're short like me, you got to scooch ahead a little bit. And just knee up as high as you can absolutely get it. Go for it. And then down. You don't have to hold, just like 1 second hold. So some of you doing fantastic. If you feel like, oh my God, I can't even lift it, like what's going on? If you're that person, this is your exercise. Because of neuroplasticity, if you can't lift at all, you guys, if you're getting tired, you can stop. If you can't lift that leg, that connection's not strong enough yet, or it's not using the right pathway. So you need to be practicing this exercise. The reason I like this exercise and why it's one of my favorites is because of the whole walking thing. If you can't lift your leg up like this, how are you going to walk? Every time you take a step, you have to lift your leg up like this. So this is the seated option. If you can do it, and you're doing it pretty well, you're confident, try it standing. Standing is even more functional. And I don't know if this is on a later slide or not, but I'm going to say it now. One big way that physical therapy is different from people who have multiple sclerosis, or exercise, I shouldn't say PT, exercise, is it has to be functional. Meaning, I don't know if you guys know what the word functional means in depth, it has to be something that you need to do throughout the day, or of what your goals are. If you have a goal of getting into and out of a car, you need to be practicing getting into and out of a car. One of my favorite exercises from an orthopedic standpoint is the one, it's called a straight leg raise. I'm sure you guys have done it before. You're lying on your back and you bring one leg up and then down. I love it because it helps you strengthen your hip flexors. However, a brain that has MS does not have, always, sometimes it does, but most likely, it does not have carryover. So again, you might have full strength in that exercise. You could probably do 1,000 of them. But this is your hip flexors, this seated exercise. Because you're in a different position, your brain might not put 2 and 2 together that you can do this. Same muscle group, but it's not, that first one is not functional. So, if you can do this seated, the next step to make it more functional is standing. And, hold on to something. We're not also testing balance at the same time, just strength. So hold on and see, march as high as you can. Perfect quality, high repetitions, not until fatigue. That's one of my favorite exercises. Does that make sense? Okay. My second one, ignore the resistance band. I have not found a photo yet that I love other than this one, but this one has a resistance band. No resistance necessary, so you've got your space. What I want you to do, and this actually might be challenging right now because I'm assuming you guys all have shoes on, and there's carpet, which is challenging. But all you're going to do, bend your knee as far back as you can. These are great chairs to use actually because there's openings, and just pull back, pull back, pull back, and then straighten, and then pull back. This is kind of separate, but I'm going to mention it too. When you straighten it, try your best not to use your arms to help you. Or if you're the person where you're going to cross your leg, you just naturally lift your leg up and over. You're just going to get weaker. Every time you do that, you're using your arms. Try to do it first. Try your absolute best. And if you get halfway or maybe not any way at all, at least you're getting that neuroplasticity. You're getting that connection. If it doesn't make it, then grab your arms and use it. but I yelled at someone the other day. I don't know if you could tell, I'm totally not a yeller, I never raise my voice, but I had a patient who was sitting in his wheelchair, and his nurse attended our initial evaluation session. And so at the end of the session, we're getting ready to go, and she lifts his leg up. Oh, it's like the worst thing you can do. She lifts his leg up to put it on the footrest. She just thought she was being nice. You know, I'm the nurse, I'm here to help. And I yelled at her. I was like, do not do that. Like, that is the worst thing you can do. He's just going to get weaker. He needs to do it on his own. And she kind of looked at me like she was startled. And I was startled that I raised my voice at her too. But then she came back the next time. She's like, I told all the other nurses, no one's helping him anymore. And he's able to do it. So, anyways, okay, so the reason I like this exercise, so you guys are doing it seated. So I don't know if you can tell, but standing, it's this. All I'm doing is bending my knee. It's the same exact exercise. And again, hold on. But when you're bending your knee, you need to be able to do this for walking too. If you can't do this to then do that first exercise, you're not going to be able to walk. Your foot's going to be dropping. You're not going to be able to lift your leg up and move forward. So this is the seated version. When you get good enough, hold on to something nice and sturdy, not a chair, because that's going to fall over if you fall. And bend one knee and then the other knee. Nice and slow, perfect quality, high repetition, no fatigue. Second favorite exercise. Okay, third favorite exercise. This, I think, is my jam. This, like, every single one of my patients does this one. Because so many people have foot drop, and even if you don't have foot drop, it's one of the most common symptoms. So, let's prevent it if you don't have it yet, and if you do have it, let's make it better. And it is shocking to me how many people who have foot drop have never even heard of this exercise, because this is a specific exercise for the muscles that, when they're weak, they cause that foot drop. So, feet are down. Pro tip for you, the further your legs are away from you, the easier it will be. So as long as your foot starts off flat on the ground, so have your legs far away, but your feet have to stay flat, like toes on the ground too, then slowly lift it up and slowly lower it. If you go slow on the way up, it's great. But if it just drops down, that's foot drop, you guys. Don't let that happen. So slowly up, slowly down. You are specifically training the muscle that needs to be strong in order for the foot drop to stop happening or to get better. So everyone in the world, I think, should be doing this exercise. Oh, and the reason this is important is if you can do it in sitting, great. If you can do it in standing, hold on to something and do it in standing. Same exact exercise, just lifting those toes up. And the reason this is important for walking is because you need to be able to bend your knee, which is the second exercise, lift your hip, which was the first one, and then put your heel down first, which is this exercise. If you can't do that, it's going to flop, it's going to drop if you do put it down. So to get that control, and if you can do all three, bam, you've got walking. You can do all three. And you've got balance, because we've worked on that too. Okay, so exercise and you. There are so many different things that you can do for exercise. So what's most important is that you find something that works for you. Everyone in this room might do something completely different, but you still get better. And so really, a physical therapist is able to pick apart what is going wrong and what can you do about it. Whereas just general exercise, like the orthopedic physical therapist, they'll give you some great exercises. I'm not bashing them at all. I also treat people who have orthopedic issues. But MS-specific physical therapists can design a program, supervise it, make sure you're doing it well. They can sense when you're getting fatigued often before you can. A common thing that I'll see, my patients are doing fantastic at the marching, and then all of a sudden, it's either this, I don't know if you guys can see. So pretend my knee, my foot. So they're doing great at marching, and then it'll be whoop, every time. And if they do that, they're going to be walking like this. Every time they lift their leg, it's going to fling out like that. If they do that more often than the correct way. So we can, if someone looking at you from this angle, I can see that. You might not be able to from your angle of looking down.
So you would tell them to stop?
Yeah. Yeah, all the time. And then they'll be like, why? They have no idea. But yeah, I'll tell them if I notice anything like that happening that's not, my patients probably don't like me very much. I'm very picky. And so I'll tell them to stop. And they're like, why? I don't understand. And so I'll explain it to them. They rest for a little bit, and then we'll do a second set. And we'll go from there. Okay, so choose a setting. At home, I have developed all of my exercises so that you can do them at home. I don't want you to have to go to a gym, because what happens in the winter when it's really icy outside and maybe it's not even safe for you to leave, or it's winter and you just don't want to leave your home. So if you can do them sitting or standing at home, even better. Make sure there's no slippery floors, no poor lighting, throw rugs, any tripping hazards. Surprisingly, one thing that I hear a lot are pets or kids. But like Grant, I have one patient, she was doing her, I guess it's because her kids. I am not a parent, so I don't understand things like this. But she was just, doing her exercise, and a kid just comes, runs into her, one of her grandkids. And I guess they do that a lot. Or like if you have pets, put them in their little fenced-in area. Or like if you guys have kids, put them in there too. And if you have difficulty balancing, make sure you're holding on to something steady. I like the sink. Make sure it's super, super dry, not wet anywhere, because you can grasp it. A countertop I really don't like. You can't grasp anywhere. If you're going down, you're sliding right off of that. Chairs are the worst. Never use a chair. Maybe a really heavy sofa. It's not good for grasping though. See what you have. But if you're doing a balanced exercise, like the single leg balance or a staggered, hold on. don't let go. You don't need to test balance and strength together. So have that if you need it. Okay, staying in motion. So have fun with it. I tell this to my patients all the time. If you don't like the exercises I give you, tell me. Because if you're telling me you're doing them, you're probably lying because you don't like them. Or even if you are doing them, but you're like suffering through it because you hate them, you're not going to be consistent with them over the long haul, and you have to be with MS. So, like what you're doing, you could water aerobics, swimming, tai chi, yoga, resistance training, Zumba, or dance. There's so many different things you can do. So, even if it's not MS specific, which obviously I think that's best, but go to a gym. What classes do they have? Pop in a DVD at home. What can you do? Just do something. Get moving. Avoid getting overheated. So this is also something I talk about day number 1. It might even be the first thing before I even introduce myself that I tell people this time of year. So a lot of people, not everyone, but a lot of people who have multiple sclerosis have heat intolerance. What a lot of people don't realize is that you don't have to be in heat outside in order to get your symptoms. And by the way, heat intolerance is just when your core temperature rises by more than 1 degree. So core temperature, that's exercise, you guys. Even if it's the dead of winter. I have one patient who was hiking in the winter, and she didn't understand why she started getting more foot drop, and I think it was tingling in her arm. But you're bundled up in the winter, and you're going hiking. That's like 2 bad things for heat intolerance, even though it might have been 30 degrees outside. So it's your core temperature that matters. Also, the effects that the heat can have on someone with multiple sclerosis is very similar to the effects of a damp, rainy, gross day with someone who has arthritis. Someone with arthritis does not need to be standing in the rain in order to feel achy joints and just stiff and gross. They wake up that morning feeling that way. They're in an air-conditioned room, maybe. Same thing with MS. You could be inside, just sitting, watching TV, in air conditioning, and you feel super heavy and just tired and gross. Or maybe you're getting numbness and tingling, or your vision is going blurred or double vision. Or you're walking around your home and you keep tripping. It can be one or several of your symptoms that feel like it's worsening on a hot day, or when you're exercising. So don't feel like you're protected because you're inside with air conditioning. Unfortunately, that just cools your skin down. It doesn't really cool your core temperature. So here are amazing tips for you guys. Drink cold, ice cold water or fluids, just really, really cold, not room temperature, cold, cold, cold. Do not exercise during the hottest time of the day, normally between 10 to 2. Know your symptoms, and if anything's worsening, again, it's not the no pain, no gain. It's not like no symptoms, no gain. If you notice something's happening, just stop, just rest. You literally might need just 2 minutes of resting, and then you can get back into it. It's not like you're done for the rest of the day. Swimming in water aerobics, make sure if you are in a pool, it's less than 84 degrees, which sounds warm, but I feel like when you get in, it's always so much colder than you think it's going to be. But it needs to be 84 or less if you're going to be in a pool. And there's so many other things you can do for heat intolerance. Cooling vests, I don't know if he's in here, but Dan's another physical therapist who's here with us today. He's wearing a cooling vest. And just so you know, they are not all bulky and heavy with these ice packs in them. The one that we have, I keep joking, I feel like I should work for their company. I recommend it to everyone because it's super light fitting. All you do with this brand is you put it in water, rinse it out. You put it in water for like 2 minutes, wring it out and put it on. And it's like as thin as this shirt I'm wearing. It weighs a little bit more once it's wet. And from what my patients say, even on a hot day out in the summer, it keeps, okay, he's in the back right now. So this is the cooling vest. And it'll keep you cool for like 4 to 5 hours. So super light. We got it off of Amazon. It does not need to be anything intense. And that brand also has wristbands, like cooling wristbands. I have some patients who get burning and tingling in their feet. I had her put the wristbands around her ankles. She doesn't get it anymore. So lots of easy, simple things that you can do, like cooling vests or cooling products. They have the cooling neck wraps. One patient recently got a lot. This was actually pretty cute. I think it was off of Etsy, and it was a necklace that were ice balls essentially, but it wasn't actually ice because it doesn't melt. I don't know the technology behind it. Super cute. It was like this floral print, and it was a necklace to keep you cool. So there's so many things that you can get.
So I don't like that. You're not getting commission on the.
I know.
So that's was like from Amazon or?
Yeah, so the brand is Hyperkewl, HYPERKEWL. And that vest, I believe, is $35 or $40. Also, the MS Society, the MS Foundation, and the MS Association of America also can give you guys, I think they're free. I should double check before I say that. Yeah. Are they free? Okay. Cooling vests, cooling products too. If you reach out to them also, those are free. So, yeah, yes. Okay. Okay, safety first. Again, I've said this like a million times now. It's not no pain, no gain, no symptoms, no gain. If you're dizzy, lightheaded, nauseous, having pain, you stop. You should have stopped before you felt that. Don't feel like you need to push through that. Physical therapy can help with what types of exercises should you be doing. What specific muscles do you have that weakness in? Is it your ankle dorsiflexors? Maybe they're fully strong, and the reason that you're actually scuffing your foot is because your knee's not bending. We can pick that out for you. It's very hard to tell on your own. We can also help you with what intensity should you be working out. For a good duration, like how long should your exercises be taking you? Safety, really just getting it to be specific exercises for you guys and what you would actually do. We've gone over that. I think we're running low on time. Okay, so another great reason that physical therapy, or that you should go to physical therapy, is because we communicate with everyone. When you come in, I'll do an evaluation of what is your balance, what is your strength, what is your walking like, what are your symptoms that you want to be working on, and we'll create goals based on that, and then we'll go from there. And we also share it with everyone that you allow us to, that you're working with, your neurologist, your cognitive therapist, your speech and language pathologist, anyone that you're working with who wants to know and be on the same page. We send them the initial evaluation and every progress note or reevaluation that we do too, so everyone's on the same page. Done. I think I made it. If you guys have any questions, I do want to point out, so I personally work in our Wellesley, Massachusetts office. We also have an office in North Grafton, which Alex is our physical therapist there. We're both MS certified specialists. Dan is in our Merrimack, New Hampshire office. So Dan doesn't have his MS certified specialist, but he has experience and knowledge with MS too. What I usually recommend, if one of our other offices without an MS specialist is closest to you, if you can make the trek once to either Alex or I for an initial evaluation, and then we'll share that with Dan, and we'll brainstorm together, okay, these are the issues, these are their goals, what can we do, and then we'll share that with Dan. So that's where we are. But questions, yes?
What do you recommend to someone who is restricted to a wheelchair?
For exercise, my favorite exercise is to do in a wheelchair. Oh, and these, I can't even demonstrate it. So if you get a chair, like your wheelchair could be one, or just a chair that has armrests, and press up, press down, press up. So I call it a tricep push-up. I don't know if that's actually what it's called. But your legs do no work at all. Get your legs out of the way if you can, and just lift your butt up off the chair and then back down. And what that helps with is, because some people in wheelchairs need assistance to get up and standing, that will make you more helpful and functional and independent with doing it on your own. Another thing I like working for people with wheelchairs is weight shifting. Oh, and my favorite one is a seated crunch. So you scoot to the edge if you can. I'm gonna fall if I try to do this. Slowly lower yourself to the back of the chair, and then bring yourself up, and it's actually really challenging for your core. Weight shifting, shift your weight all the way over onto your right side, and then to the left side, reaching without losing balance from your seated position. So many things that you can do in a wheelchair. If someone comes into me in our clinic, I'll also still do standing. Even if someone in the wheelchair is not walking, standing is such a great exercise. Your muscles on the front of your body need to work the same intensity as the muscles on the back and the right side and the left side. If one's not working as much, you're going to be tipping over. So if you can at least just stand, that's fantastic. And blood flow and all muscle use, so many good things. Yeah. Yes?
I was wondering about the gait cycle.
Uh-huh.
And part of that gait cycle is momentum,
Yes, right.
which isn't mentioned here.
Right. So that's another reason why I think my patients might not like me a lot. I take momentum out of it. If you're going fast, yeah, you totally can use momentum. But if you're using momentum, at least in my eyes as a physical therapist, it's making up for the weaknesses. So the goal of exercise in my presentation here is let's strengthen that. So then if you use strength and momentum, you're going and you're not going to fall. But you're 100% correct. Momentum definitely helps with that. Yes?
Do you do anything with braces to help somebody stand who's otherwise in a wheelchair? I mean, just to get that straightening?
Yeah. So there's a stander that you can get. I actually just coincidentally looked this up. It's like about $2,000. I don't know if you'd have to cover it on your own. I don't know if insurance would cover a little bit of it. I also know that there's some financial hardship allowance through the MS Society too. But there's a stander that you can get that you put a little sheet, if you will, on the wheelchair or the chair, and you hook it to the stander, and it helps you stand up. And then there's a little thing you can hold on to for both hands, and you just stay standing for as long as you can. So there's that.
But it doesn't like lock your legs straight.
Good question. So it has a little sling for the thing that you're sitting on that keeps you there. It also has a plate for your shins. So you've got kind of you're keeping your butt in, keeping your knees back. So it has both, and then your hands up here. So yeah, so even for people who are super weak, they could use one of those, generally. Yeah, right behind you.
The neuroplasticity that you mentioned,
Yes.
that seems to be potentially a longer term development.
Uh-huh.
Develop some motion that you don't have now.
Right.
And a long time plus the uncertainty of it seems to put it out of the realm of the patients of normal PT.
Yeah. So one thing, I don't know if this targets that, but so the question was, neuroplasticity can take a really long time, which really means a lot of this is in your guys' hands. Once you're provided the exercises, you gotta have a lot of motivation to keep doing them year after year after year. So if you can, I mean, we have what we call an open gym program at our PT clinic, where it is more of a maintenance program where you can come in, everyone there has MS, you can kind of bond over that too, but it just gives you more of an environment that you can do those types of exercises with and keep you consistent. Because often I'll have patients will be working together twice a week or once a week for 6 months, then they stop, and then they come back and they're back at square one, and they admittedly say, I didn't do the exercises. So those are the people that I want in my open gym. You need to keep doing them. But motivation is different for everyone. You have to, in my mind, you gotta think about that big goal. What could this do for you? And see if that keeps you going. Or if that's too big for you, what could this do for you in a week? Maybe reward yourself in that way. But it's to keep doing them year after year if it takes that long for you for neuroplasticity. Because again, we don't know. Some of these things, it might be a month. Maybe for the marching, it's a month. Maybe for the knee bends, it's a year. It's different for everything. It's not like neuroplasticity as a whole will take X amount of time. Does that answer your, okay. Any other questions? Yes?
Would you introduce me?
Yes. So this is Nancy. So Nancy is our occupational therapist. And so she also works in our Wellesley office. I suggest that every single one of my patients at least has an evaluation by an occupational therapist, and as well as a cognitive therapist and speech therapist, everyone. Because, especially if you have really any form of MS, relapsing remitting, or primary progressive, secondary progressive, any of those, you never know what symptoms you might get. So just get an evaluation. So Nancy's our OT. Every person, ideally, that I'm seeing will be seen by Nancy. And Nancy, you can correct me if I'm not saying this correctly, but physical therapy is more this stuff, legs, walking, getting in and out of cars. Occupational therapy can be something like hand strength and motion and stretching and spasticity and all of that, as well as writing, typing. Nancy also covers fatigue management and also talks about the cognitive aspect of MS too. Anything else?
Energy conservation.
Yeah.
Adaptive devices, activities of daily living, and how to deal with them. Even trying to decide whether or not you want to do your own self-care, or you want to pay someone to help you do it, and then save your energy for later. So all those kinds of discussions.
And even she mentioned activities of daily living. That could mean pouring a cup of coffee, folding your own laundry, so things like that. Any other questions?
Nerve flow.
Yes.
What about acupuncture?
Ooh, yeah, what about it?
Have you dealt with that as far as improving nerve flow?
So, okay, I will say, I honestly don't know too much about acupuncture, but I have a couple of patients who use it, and they love it. They feel like it helps with their spasticity, it does help with their fatigue. Every person's different. I have one patient right now who I see every Friday. On Thursday, coincidentally, on Thursday, the day before I see her, she gets acupuncture. And I used to see her Mondays and Fridays. She walks so much better the day after she gets acupuncture. I don't know why. I don't know the research or anything really about why that works, but at least for her, it really helps her. We also have a massage therapist at our clinic. There's a lot of research being done now with spasticity and massage, so that's something that I'm kind of getting my patients to at least go once or twice, see if it can help with spasticity. Should have put spasticity in here. It's one of the biggest things. Stretching is great for that. Yeah. Yeah.
Just a point of information, MSCS means what?
Multiple Sclerosis Certified Specialist
Certified Specialist.
is MSCS.
And
Yes.
that's PT plus.
It's actually PTs. Nancy, does OT have is that also the MSCS?
Yeah.
PT, OT, I think neurologists. I know nursing has their own, but yeah, it's a big group of healthcare professionals. Yeah. Okay, I think we're gonna end it there. I'll be around if you guys have any other questions. But thanks for coming to my presentation.